I wanted to provide a brief sample case conceptualization, imagining a situation where acceptance and commitment therapy may be used to help diminish a client's suffering. So, in this case, we have a 46-year-old woman who is experiencing anxiety about her son. And this child has been very difficult to parent from the beginning, has several big behaviors, including some physical aggression. He does have diagnoses of ADHD, ODD, and OCD. So in this case, we have a parent whose child has a big cluster of issues that she has spent a lot of time and mental energy trying to solve. So this mother has tried every type of therapy available for her child, including talk therapy, occupational therapy, behavioral therapy, medication, dietary interventions, and social skills groups. She's read a handful of books, she's seen a handful of specialists and coaches, and really she feels that things have only gotten worse. She worries constantly about her son's future and has started to give up on ever having a quote normal life, as she states, and has started to withdraw from life. So if such a client were to present to my office and provide a history such as this would be a good time to use acceptance and commitment therapy. We have a client who has tried to solve the problem rationally and logically using the interventions and tools that are at her disposal, and nothing has seemed to help. The way that I would start this session would be to provide informed consent to the client. So when you're providing informed consent for ACT, you can't always give a very detailed explanation of what is going to happen. This is because, number one, ACT is more of a concept and a framework than a very strict set of procedural rules, but also because it will differ so much from what she may have already tried. And therefore, it may be hard to explain to her in a brief way what will happen. I would warn the client that there will be a lot of talking up front as I try to get her to understand the point of view that this therapy is coming from. And then I would ask her to characterize the problem as she sees it. I would take care to note whether she is particularly avoidant, whether she is stuck in thought, and how present she is in the current moment. And then I would ask her, depending upon her level of tolerance, I would ask her to describe what she is feeling and experiencing in the moment. I would be very careful to see whether she told me really what she was experiencing in direct contact with the present moment, or whether she shared more of her thoughts. If I felt that she was having a hard time accessing her feelings and her contact with the present moment, I wouldn't necessarily push too hard in the beginning, especially if I see that she's deeply embedded in cognitive fusion, which is the process of being so tied up with one's thoughts that they're sort of all that one can see. Once we had gotten to this point, I would help guide her into a process called creative hopelessness, which is a surrender or letting go of the things that she's been trying with her son that have not been working. I would ask her to describe to me how she has tried to solve this problem in the past and what her current approach is. And then I would help her come to the conclusion on her own that nothing that she has tried up until that moment has worked. I would be very careful to let her come to this conclusion on her own, and I would let the experience of things not having worked speak for itself, rather than pointing this out to the client. Once I get her to accept that she is in a place where possibly nothing will work in the way that she is seeking, and get her to a place of acceptance, which again may not happen in the first session. It may not even happen in the first couple of sessions. I will begin the process of diffusion, which is helping her to separate out her thoughts and emotions from her. and from her present experience. So I would help bring her back into the present moment as she's facing the hopelessness of her situation. I would never use the word hopelessness, but I would help her to see that she can come to a place of more acceptance. I would get her to a place where she would accept that maybe there is no solution to this problem and that maybe there is another way, which is not trying to solve the problem at all, but giving up on trying to intervene in a logical way. I would ask her, what is her choice? What is she going to do if nothing will work? What then? I would ask her what it feels like to sit with that notion, that there are no guarantees, that things with her son may never change on certain levels. I would help her sit with that uncertainty. Again, this would be a very slow process in guiding her to that place. She may be more or less ready to get to that place depending upon where she is in the process. It's really important to validate and acknowledge that the client has done all that they can do. And I can use this as an invitation for the client to try something new. Once she has acknowledged that, and she has agreed to choose a different path, she can move forward. But acceptance is always the first step. So I wanted to talk about that first part of the problem, or the process rather, because once a client is able to accept that they may not get the solution they are looking for to the problem that they are trying to solve, that in fact the problem may be insoluble, they can get to a place where they can identify their values and figure out how to move forward towards those values in the context of their current situation. An example in this case would be to help the woman identify what is important to her about her relationship with her son. She can't control many things about his challenges, but she can, for example, commit to being a loving parent and to connecting with her son even in the midst of his difficulties. She can commit to being present for him even when he is having a difficult time and even when his behavior is not in line with her expectations or desires. This radical acceptance can free her up to be the parent she wants to be in spite of the circumstances not being exactly what she wants them to be. So I'm going to stop this here, but I wanted to just briefly say that this was based on a video that I watched with Stephen Hayes performing ACT with a succession of different clients and moving through this first portion of the process with them.